How do you address the collective issue of physician-owned hospitals? Do you cast them to the winds and say they're all bad, or do you understand that some of them are opened up in minority communities and are the only hospital that these individuals have access to? So I've raised a lot of questions, and I raise them so that you can be poised to answer them. I've also hopefully want to put on the record my deep appreciation for Chairman John Conyers, who's, if you will, struck out like a lone wolf some many, many years ago, as he'd done over and over again, to get our minds focused on this big issue of universal access to health care. But if I can leave you with anything else, I believe we must proliferate these kinds of meetings all over America. We have to have standing room only. People are frustrated now. They're trying to find out how to pay their mortgages. One more pronounced problem probably is going to, if you will, tip their cups open or over. But we've got to be in the business of saying, to restore the capital markets, to get your mortgage and your house back on track, does nothing if you don't add in education and health care. Does not get us on the right road to the 21st century, the right road to success. And I'm hoping that that is the kind of mindset we can have. I know with the members of Congress that have come through today that we certainly are trying, and with you we know that we will have maybe the opportunity to sing a song that I've sung in my lifetime, and that is, rather than we shall overcome, that we have overcome. That should be our goal, and I thank you all very much.
Questions of our panel, would you be willing to field a few? Should anyone in the audience, can we hold you just for a few seconds?
I'll take a second.
Because of your on the spot. Are there one or two questions for the Congresswoman? In the back in blue, yes, sir.
Yes, Stephen Spitz from PDA, Progressive Democrats of America in Virginia. I have a question. It is generally accepted on the Hill that the health insurance industry is, quote, for healthcare reform. Now, I had the experience last week of attending a hearing in the Senate, and I listened to Karen Ignani and the other people with the health insurance industry, and it's very clear that they do not want health insurance reform. All they want is government subsidy to purchase their outrageously expensive insurance. My question is, how can we effectively communicate to the Congress and to the American public that the health insurance industry is not really serious about reform, that giving money to purchase their insurance doesn't make this healthcare system better?
That's my very point. The point is that with the deference and respect to my colleagues who will ultimately be casting the vote, we have to have a full press on educating and distinguishing and making fine lines. When we talk about a public option, it must be, to a certain extent, defined such that it is a pure public option. I think what we might do is use the horrible mistake of Medicare Part D in that whole process, of which we argued extensively against putting in the hands of drug companies. Now, people are torn because, as you well know, the argument for pharmaceuticals is that monies help them expand their research. But the older we get, and in many instances older and sicker, there will be no lack of opportunity for the utilization of their research, the need for their research, public-private partnerships on research. So they're not going to be left out in the cold. The key is that we are trying to unburden a tangled system that leaves Americans in the cold as it relates to health care. We have to put it in that context, that if the private insurance companies will come to the table and say, we'll bare our souls, we take no profit, we do simply want to provide health care, then they can be our partner. But if these subsidies are simply to do business as usual, which is what I think has to be explained to, as I indicate, the vast diversity, the big tent of Democrats, Mr. Massa's district, he may have some questioning constituents about these issues. Now, I will tell you something that is going to be a big hurdle. It's going to be the question of choice. and the question of those who have insurance and what you do with them. I am quarreling with myself. As a lawyer, I have to look at the many aspects of how do I get past that hurdle and still get where I think we need to be. Because as we grow and we are able to show that we have a refined, superior public option system where people can get the best surgery, the best consultation, the best minds can be engaged in consulting on you and doing research that is positive and not have the kind of embarrassment of clinicals that were evidenced in a hearing just this past week, where bogus companies can be involved in that, but where we can have serious studies, where we can understand the heighten or the superiority of research. We've got to convince the public of that. So to answer your question, we have to unbear or turn the light on those who are using this opportunity to just get better, to just get more into the system. We've got to educate constituents alike by what the value of a public option and universal access is going forward. Because you don't have anybody here that's seen that. You have people here who've heard about what happens in England. You hear people who hear horror stories of Canada. Remember, they haven't been there, but they hear it, and that's what they're working on. We have a large mountain to climb. And then lastly, we have to be fair to this issue of choice, because we will go down in smoke if we're not finding some kind of response to this issue. I'm not suggesting that the Gene says these panelists don't have an answer. I'm still quarreling with it, but I think that's one of your challenges. But don't let them get away with it. You were at a hearing. I'm not sure if there was a member over there that maybe questioned, but I can assure you, well, there you are, so the record was sort of probed. We'll be probing them as they come forward, and I can assure you that we have a taste in conclusion of a 6-hour vote on the Medicare prescription Part D. We were on the floor for 6 hours, fighting to not have it pass. Unfortunately, it was a different time, and it did. We will never forget.
Thank you. Thank you. Thank you, Congresswoman. I know that there's a couple questions for the panel. I'd like to ask if there are any participants who would like to direct their questions to our panel, that we could do so this time. I have been told that votes are imminent in the House, so we may be pulled very quickly. So, for our distinguished guests, is there any questions I'd like to direct? Yes, sir, in the front.
I think I introduced myself already. I'm a pediatrician here in D.C. I have a couple of questions for the panel. The first question that I would love to hear from the panel on is this issue of the public option. I am perfectly fine with the concept of public-private partnership if what that means is taking public money to pay for health services provided by a private delivery system. I have no issue with that. But I get questions all the time when I give talks in grand rounds about why can't we just regulate the private insurance industry? Why can't the government regulate them? And I would love to hear your response to that. That's question one. And the second question, very briefly, is, and I get asked this all the time as well, and I would love to hear from the panel, is we have a huge primary care shortage crisis in this country. Now, right now. We get 450 calls a day to my clinic, and I have 150 appointments to give. That is the reality. So I ration care every single day. Okay? We have twice as many specialists as primary care doctors. I want to know from the panelists, the experts in this room, what is it we're going to do to address that issue of this enormous primary care shortage in the upcoming weeks and months?